No problem.
Thank you, and good morning, everyone. We appreciate it. You've been here this morning. It's my privilege to sit next to His Excellency, Mr. Christian Berger, the Ambassador of the European Union to the Arab Republic of Egypt. My name is Everton Santos. I am a Vice President of Research class for International, and it's my honor to be here with you today. I have been coming to Egypt for the last couple of years, and it's been fascinating to see the growth of healthcare. Before I introduce Mr. Christian Berger, I have a couple of things, remarks to talk about the role of healthcare in digital health and population health. So I'm going to come over here to the podium, if I may, just to share some preliminary insights to set the tone for us this morning. Like I said, I coming from the U.S. With Class Research, we are an independent research firm in healthcare IT. We measure vendors that are delivering healthcare technology to hospitals and clinics to take care of populations and leverage the technologies that they have to better treat patients and to improve the delivery of care. And in terms of our influence, we conduct about 20,000+ interviews a year to help decision makers to make better informed decisions when it comes to the delivery of selecting technology to deliver better healthcare to the general population. But I want to spend a couple of minutes today here to set the tone. We're going to be talking a lot about on this session about investing for the future opportunities and trends. We're going to be hearing a lot about the health and population infrastructure, the technology, human capital partnerships, which are the key decision support in this endeavor. I do want to kind of emphasize a little bit the role of technology in all of this, and the importance of the population health and how to keep a healthy population within a framework that we have established. Class sits as an independent research firm. We have the privilege to publish content to the industry, and one of the content that we publish is a framework around population health. we got together in Salt Lake City, Utah, with a few decision key makers in healthcare, and build a framework around population health and how that has evolved over time. One of the things that around this framework is the creation of 6 pillars, which helps us to better understand from a health management population perspective where we should start it. First and foremost, you got to have some sort of data aggregation to really put together disparate sources of data into one single platform to better understand the health of population. So that's the pillar number one. Pillar number two is around data analysis. It's really have the automation tools to stratify population risks across a community. So having dashboards that will allow decision makers at the care delivery point in hospitals and clinics to better understand where the risk factors are. And thereafter, it's really having a care management team of tools that enable the care management to really track and plan and coordinate a population that can be monitored for diseases. And for decision makers, really having administration and financial reporting tools are critical to better understand via dashboards what are some of the analysis that can be done for financial and clinical outcomes and results. Patient engagement is another one. We are seeing this as an evolving topic. Is really to better engage with patients. So it's really the ability to have a patient to schedule their own appointment, having video consultations, pay their own hospital bill, and really keeping informed of their lab results and things of that nature, and have a history of their electronic health record. And finally, it's having better clinician engagement. It's really functionalities that enable clinicians, doctors, nurses to leverage population health management tools at the point of care, and to really track the utilization and the improvement of care. So that's the foundation of the 6 pillars that we have in our framework for population health. I know we're going to be talking a lot about some of the different ways how, from a government perspective, how that can be done. But leverage technology is one way that we see as a fundamental keystone for improving the care delivery in our communities, in our respective regions. And finally, what I wanted to conclude is talk a little bit about some of the healthcare investments. So over the last 12 months, we got a chance to interview about 186 healthcare organizations from around the world to better understand from a technology perspective where they're looking to invest and some of the priorities for their investments. And we're still seeing a lot of digitalization and EMR initiatives around with cybersecurity and digital health. Those are kind of the key elements for the investments that organizations are looking to do it. So with that being said, I just wanted to kind of set the tone on the role of technology and how important that is a place in really fostering a better, healthy global population. So with that being said, it's my honor to introduce you to our distinguished guest, Mr. Christian Berger, His Excellency Ambassador of the European Union to the Arabic Republic of Egypt. He started his public service in 1986 when he served as Operation Ambassador with the Austrian United Nations Peacekeeping Battalion on the Golan. And throughout his distinguished career, Mr. Berger has worked in numerous organizations, including the United Nations Relief and Works Agency in Gaza and Jerusalem, with organizations for security and cooperation in Europe, in Vienna. In 1997, he joined the European institution in Brussels, later joining the committee with the European Commission overseeing the Syrian relations. He then served as a political advisor on the Middle East issues. He was also the EU representative to the Middle East Quartet Special Envoy. And then from 2006 to 2008, he was the head of crisis response and peace building. Subsequently, he served as the EU representative and head of delegation in Jerusalem. From 2011 to 2016, he worked as the director and deputy managing director for the Middle East and North Africa. in the European External Action Services. And then from 2016 to 2020, Mr. Christian Berger served as the head of European Union delegation to Turkey. He's an Austrian citizen. He's married, has 2 children, holds law degrees from University of Vienna and University of London. So, with that being said, let's give a round of applause to His Excellency Mr. Christian Berger, ladies and gentlemen.
Thank you. Good morning. You made a very important, I think, remark, and this is my disclaimer and disclosure. I'm neither a health nor a population expert, so forgive me for talking more about foreign policy and about development policy in the context of this conference rather than about the technical aspects of health and population. So first of all, thank you for the invitation and thank you for the European Union to be invited to this conference and to speak. I think it's a great pleasure being here, and I'm happy to see so many people despite the long night last night at the pyramids, and that you all made it this morning and got up and came to this conference. And this is not the first conference here in Egypt. There was a conference already about 30 years ago in September '94, which was hosted here in Cairo, and it was the largest intergovernmental conference on population and development that was ever held at the time. It was the International Conference on Population and Development, ICPD. Now, ICPD represented quite a significant landmark in the history of population and development. It attracted the attention of the global community to human lives rather than talking about human numbers. And quite importantly, ICPD affirmed that the empowerment of women and girls is crucial in ensuring the well-being and welfare for all, and affirmed that the right to make informed decisions about sexual and reproductive health are amongst the fundamental rights that we enjoy. The program of action that was adopted in '94 at that conference provided a foundation for the 2030 Agenda on Sustainable Development and many other initiatives that followed. The world since then has achieved noticeable progress in many areas, and I just would mention the decline in extreme poverty, lower levels of maternal and child mortality, and longer life expectancy. Progress, however, has not been even, neither within nor between countries. In many parts of the world, there is still gender disparity and a persistent challenge to persons living in vulnerable situations, such as with disabilities, such as migrants and women and girls in rural and informal settings. Despite significant efforts to accelerate progress and address challenges, demographic trends, as well as economic and social shifts have been affecting the capacities of many countries and key actors to fulfill their promises. Additionally, while the COVID-19 pandemic and the geopolitical context contributed to tremendous challenges, they have fueled our convictions that population and health issues have no borders. To maintain the momentum on progress achieved and address evolving challenges, the global community needs to reflect and to work together. Dear guests, the European Union has been a global forerunner that supports an accelerated progress in population, health, and sustainable development within its borders and through its external actions. And I would like to give you a couple of examples. The European Union and its member states are amongst the largest funders of global health and sustainable development in the world. The support provided to respond to the COVID-19 pandemic is only one example. Through our Team Europe approach, we supported initiatives together with the Union itself, the member states and the European financial institutions, and we support now global health, population and developmental priorities that are conducive to achieving the Sustainable Development Goals. Between 21 and 27, Team Europe initiatives are reaching about 500 300 billion euros of investments for sustainable and high-quality projects. All is anchored in the 2030 agenda, and we have recently adopted the European Union Global Health Strategy that aims at improving global health security and a better health for all in a changing world. The European Union Global Health Strategy responds to an evolving and new global health order with a strong need for innovative finance, pooling of resources, use of technologies, and co-investing with partner countries, EU member states, European financial institutions, and the private sector to address interlinked priorities, which are, in our view, better health and well-being for people across the life course, strengthened health systems and universal health coverage, prevention and combating health threats, including, of course, pandemics. Fully aligned with the 2030 agenda, the EU Global Gateway is another example of how the European Union translates commitments into actions. The Global Gateway is the European Union's contribution to narrowing the global investment gaps worldwide. This new strategy boosts smart, clean and secure links and investments in digital, health, education and research systems across the globe. For instance, the total investment under the Global Gateway Africa is a package of about 150 billion euros. In the framework of supporting global health, the Global Gateway contributes to strengthened healthcare capacities around the world, and it facilitates investment in infrastructure and the regulatory environment for the local production of medicine and medical technologies. At the country level, here in Egypt, the European Union has forged a strategic partnership to support Egypt's Vision 2030